Great, and we also are behind the scenes, so we're not directly connected to the students or the recipients of these meals, but we do speak to teachers and we speak to different people in the community to find out where are the struggles, and then we're distributing the food. So when we go to a school to package the meals, we're asking them, do they have relationships with the local food shelves, and if so, who, and how can we start to create a new relationships there so the food gets directly to them. We have a long relationship with Every Meal, and we've donated millions of meals to them, and it's been great to see them as they continue to grow and spread these meals out to different schools. Just last year, we packaged 3 million meals, and we're constantly being asked for more meals than we have available. So we're always looking for new partners to grow within the community, and then we distribute them as needed. And typically, the feedback we receive is always positive, and they're saying it's not only is it nutritious, but it tastes good, right? Because we all know no matter how nutritious it is, if it doesn't taste good, they won't eat it. So so that's kind of our stance in how this works and how we distribute our meals.
Thanks, and I'll just take this back.
Yeah.
We in the about 400 schools that we work in, our programs offered to every kid in the school. So an enrollment form is sent home in their folders or whatever to each kid in the school, regardless. There's no like social workers not identifying who they think does or doesn't need it by any criteria. It's just offered to every kid in the school. They also typically are able to sign up through email or whatever. The list all stays at the school, so it doesn't really matter to us how they enroll. We just want it to be an opt-in so that it's not an assumption based made by typically an adult. We want the family to opt in and to choose to participate. That's part of the dignity component as well. At the same time, we have 181 schools on our waiting list. Schools that have come to us and said, our kids are also taking extra food home from the lunch line, also having behavior issues leading up to the weekend. Is there anything you can do to help the kids? And we have not been able to say yes to add our program into those schools. So some of those are in the Twin Cities, some of those are outstate. Probably about half and half as far as in the Twin Cities and outstate. But yeah, so that's actually another gap, I guess I would say. But yeah, ours is, there's no income requirements for our program, and the form is just the kid's name and who the teacher's name is. It's not any other details besides that.
Nice. I feel like I'm almost feeding you these responses to like move us into the next question. So you mentioned Greater Minnesota, and I was wondering if we could now dive in a little bit to some inequalities that we see across the state. So you also mentioned, Rob, earlier, culturally relevant meals. So I was wondering if we could talk a little bit about the inequalities that you see that your organizations work to address, what is maybe missing still, what you'd like to do in terms of equalities, and how you're able to provide food for, people across this great state, right? Nobody's going to be the same. How do you address the culturally relevant food that you would want for individual families?
Well, as we know, there's lots and lots of cultures in Minnesota, which is great. And our bag types, currently we have we have 5 types. Within each type, there's at least 4 menus, so the kids get something different each weekend. And so we have a bag that's sort of like our widest variety general bag. And then we have a bag tailored for East African dietary preferences, another one tailored for Southeast Asian dietary preferences, another one for Latina dietary preferences, which, yes, is a whole continent and like a third of ours. So that's a whole other issue. And then we have our last type is that more kids for a more mobile or transient situation. So those are the sort of culturally and situationally relevant and good food bags are. As far as, so there's many other cultures that we would like, or for instance, the Latina, breaking that down a little bit, at least, but also many other cultures that and dietary preferences that we could add, obviously, as we know. But those are the largest quantity of kids in the state. But the limitation is, the limitation is for us is on every bag type we add adds significant cash flow costs because we have to add additional food that we purchase, that we store, and goes into logistics stuff that I don't think anyone's that interested in, except for me, and maybe we can talk about it. So that's one of the big limitations really with all of everything, and food gaps and everything is typically finances. And that's one of the big issues that we all have to deal with. As far as out state, we work up to, up to Mora, I think. Mora is probably the furthest north, Cambridge, Santee. We go west, we go down to Worthington, and Adrian, which is we can have a whole session on that situation in Worthington. And then we go down to, I think it's called Triton by Rochester, and over to Wisconsin and up. We don't go into Wisconsin, but so there's obviously need everywhere. Every public school in the state of Minnesota has kids facing food insecurity. Every community, every school, every classroom, and when you get further out state, as things spread out, just like population and school location, busing, or not school busing necessarily, but like city transit or public transit is more difficult. So even getting parents to be able to get to the school buildings for even like conferences and stuff is very difficult. They might not be on a bus line, that kind of thing. And so as you get further out state, there's different challenges. Lots of times that becomes a transportation challenge, but also so like in Worthington, if you've read some of the news, there's actually a very high number of unaccompanied minors that, I was going to say ended up in Worthington, but that are in Worthington. And there's the meat packing plants and stuff. There's a big population down there, and there's lots of controversy as you get into these smaller towns. Trying to think of how to politically kind, with how the change of demographics within the towns and how that could cause a lot of rifts in the communities, and so like in Worthington as an example, some people view the problem of food insecurity because all of these immigrants came in and created this problem, which there are a lot of immigrants in Worthington now. They also are like revitalizing the town, so let's put that on the side. And some of them do need food support, as do many people who have lived in the community for a long time. And so that's one of the barriers, and as you're dealing with some of those, because small town is a culture too, and each small town has their own culture. And so kind of working with those relationships is one thing that is interesting.
Nice, and William, before you start, if you want to even expand it out aside of Minnesota and how you're dealing with inequalities, across, that'd be great too.
Sure. So I've mentioned the cinnamon instant oatmeal that we have, and it is great because everyone recognizes it and knows how to cook it, and that works really well. The other meal that we have is more for our international, and it's a rice pilaf. And the reason we've chosen these ingredients is because, one, rice is the most recognized food in the world, so people know how to cook it. And we add soy to it because per pound it has more protein than even red meat does. And we've added vegetables because they have a lot of vitamins in them. And then we add a vitamin mineral mix that really has a lot of the nutrition that these meals provide. It's the same vitamins that go into the oatmeal as well. And then one thing that we do with this rice pilaf is we've designed it to taste very bland. And that works really well because people in the different taste buds and people in Haiti. And when we've provided it here as well, some of the Latino community has really appreciated it because it's a rice and beans, and it's a comfort food for them. different communities are then able to add their own spices to it. And when I the Philippines and sharing this rice pilaf, they showed me a way that they liked cooking it, and they would wrap it in a tortilla, add chocolate to it, and then deep fry it, and it was delicious. So the value of designing it to taste very bland works really well because it can then accommodate so many different palates. When we provide it here, it's always fun to see how they create different menus to go around it, and it's more of a side dish in the United States where they'll have it with a piece of meat or something else. But in Haiti, it can be their whole meal. I wasn't in Haiti, but I was in Atlanta at Georgia Tech. We were doing a meal pack with the inbound college students. And after we gave the presentation and talked about the education piece and the food insecurity around that area, 2 women came up to me and said they had just moved there within the recent months and were living in Haiti. And the food that we were packing that day was what they've lived on for the past year. And that, is the type of thing that really hits hard because they are so food insecure, unlike in Minnesota. So there are insecurities all over the world, and we talked about how many people need food here, but there's differences. And so to be able to provide this meal and make sure that it tastes bland so that they can add their own ingredients to it to spice it up the way they want is really been valuable. So it's nice to be able to accommodate so many different people and cultures.
All right, I think I'm going to start with the Greater Minnesota rural piece of it first. So the gaps there, again, working with schools, working with organizations, again, around childcare or educational programming, we typically have children in one place where we are serving a meal. But in Greater Minnesota, when we're talking out of school time, that's of course where huge gaps are because children don't have that bus on the weekend, don't have the ability, and I grew up in a really small town too. I was 4 miles down a dirt road. There's no way I was going to get into town without a ride. Although sometimes I thought I could with my bike. But so it is a really difficult piece to try to go then outside of those school times to go and get meals. So one piece that we're trying to address that with is the United States Department of Agriculture released the rural non-congregate waivers or flexibilities. This was after COVID. It's now a permanent piece of the summer food program. And so we adopted that last year and implemented it. And it's for schools or schools, tribal organizations, community organizations can, although it would be a lot of partnership with that school, and usually the school takes it on, to provide meals. Again, it's the healthy, nutritious meal, but it is in a multi-day pack so that those meals can be sent home with the child so that parent, guardian is not trying to get child 8 miles down that dirt road for breakfast, come back 8 miles down that dirt road for lunch, come back. That is a lot of miles and a lot of distance, and parents, guardians are still working during the summer too. So that's one way we've tried to address that. We saw a huge success. I don't have the numbers off the top of my head right now, but saw a huge success last summer. We are expecting, I think we put into our plan about a 15% increase this summer because we know the need is there. As far as culturally relevant foods and ways that we're seeing our organizations and schools do this is a couple of different routes. One, a fun break, not for me, but for the Fond du Lac tribe. They just received a grant from the USDA directly, so again, not through us, but they're working with other schools and provide recipes for culturally relevant meals for schools and organizations to use. So the Fond du Lac tribe has that on their hands right now, and they do amazing work. And we see that a lot with our schools and organizations too, trying to share recipes now and so on. A gap of that before is, like Rob Williams said, the money part of it. Schools and these programs too, barely pay enough for the food. There has to be some other type of revenue coming in typically to make this meal program viable. But so with school meals, we are hoping, and this is what we're really targeting in the next couple of years with our education, is there's more money coming in. Let's beef up the quality of those meals. Let's do the things that we want to do. Let's make sure our students can see themselves in those meals and those options that are being served. So that is one way that our schools and organizations have done some work, are doing some work, and then what we're hoping to see in the future.
Nice. So you mentioned the Minnesota Free School Meals, which, and at the beginning you also mentioned how successful it was last year, and it's just incredible. What other, local or state, state level, or even local, or national legislative work do you anticipate coming in? I know that it's, things are starting out in January. Our president was just sworn in. Things are a little weird right now, but what would you like to see, maybe would be another way to phrase it too.
Ooh, anticipate and like to see,
Yeah.
very different, I think. It's been a crazy week. Of course, the administration change always causes some sort of pause and anxiety. And we're seeing a pretty big attack on meal programs right now. So to that point, anticipating there is legislation, we were just talking about this morning, there is some legislation that is making its way through at the federal level to reduce the community eligibility provision. And I say reduce, which would reduce the amount of federal funding. It actually increases the threshold that schools could use for that program. CEP is really difficult. I'm not going to try to explain it. What it ultimately does is there is a certain threshold of children at a school, and then the school can claim basically all of their meals under the federal funding. And so that is somewhat under attack right now. So anticipating there to be a lot of fight over that. I think as we've seen in the news too, in some of these attacks, when we think through it, much of these have to go through Congress. It would take an act of Congress to actually make these things happen, not necessarily an executive order. So I anticipate a lot of fight, maybe not much action. That's just me personally. At the state legislature, we have a bit of a budget surplus and a budget deficit. We are not seeing much happening at the legislature, but I do think the Minnesota Free School Meals, the success of that, the price tag of that, will be called in, and we'll get to really showcase the benefits of that, but I don't see much change there. One last thing that I'll say to that is summer EBT. So this was a brand new program. I'm not sure if you're aware. It's where USDA tried to bridge SNAP and the child nutrition programs. Again, going back to summer food, only 1 out of 6 children accessing that summer meal program. Summer EBT follows SNAP in a way in which money is provided for the families of children who qualify for those summer months. And so I'm assuming that we're going to see some fight there at the federal level as well. It's a new program, but again, that is one area that we've seen a lot of attack.
Yeah, I have a lot of concern about what's going to happen with the new administration, and would really like to see SNAP continuing. There's a lot of good and a lot of evidence that shows that kids that are receiving breakfast at school are finding more success. They tend to have less disruptions, they have longer attention spans, and because of those, the test scores tend to increase. So if we can see food security around breakfast time at school, I think there'd be a lot of value in that. I guess we're at a point where we're a lot of wait and see, but my hope is that it continues based on the numbers and the proof behind it. I'm not too eager to see what might come, because I don't see that going in the best direction for our students. But if we could see that SNAP continued, I think that would be really valuable.
I have no idea what is gonna happen. I think there's gonna be a lot of focus on decreasing costs. And so that's part of, I think, what we were talking about before with the federal CEP qualification. And if that goes through, that decreases the money that comes to Minnesota to help fund the free meals. I think at the state level, I do think there's gonna be a lot of focus and critique of the free meals and whether trying to make that not continue, which I think would be a big detriment to the students. That's assuming, they actually do stuff at the state level. Who knows?
Awesome. Okay, so I think we're about 8:45 here. We're going to break to do some table discussions. So at your tables, there are sets of note cards. Think about questions that you might have for the panelists. I think one of the topics that I'd like us to cover when we come back together around 9 is what can we do moving forward? How can we support the organizations that are out there doing the work? And what else can public health do that we aren't already doing? So that'll be one topic, but please come up with questions, discuss with your tables, what you might want to ask these panelists. So we'll break until 9. Bathrooms are right outside. There's still some food, coffee, juice, water. And then again, I'll give us like a 5-minute warning and we'll be back together. Thanks, everyone.
Hello, I'm Leslie. Hi, nice to meet you. Thanks for coming today. If you have a question, please put it on here. Yeah. Think about
Yeah, especially with we don't do so there's money in Medicare, college.
Maybe that's what I'm saying.
So, I mean, food insecurity with kids, that's often, it's often like kids are poor than the concept of people thinking that kids are poor than care around sure that happens sometimes. Almost a comfortable number. It's typically like parents aren't eating, and then that affects you go, and then that affects the parents' work, and then that's their income, and then for the kids, they can't pay attention in school, and it's hard. It's basically and then if learning as well, cycle of this stuff, reveals all this stuff. The point is, so we're just you can see great testimonies, but you can't just study on it because you have food.
Yeah, it wouldn't be helpful.
Yeah, so, but the long term, it's about 10 to 15 years. It's not, no one's going to see that like, oh, well, that's because of the programs as well. But
So, but and that's really where most public health programs aim to make change. Right? You're not going to make change in one community. But we are trying to. I see for my data team, which I've now overseen the separate division, they come in very data. They're like, wow, you just make data. I'm not just sitting here. But we're teaming up to start to pull those things with test scores, with the types, with behavioral issues. And right, you can't have two cohorts, but we can definitely show correlation. Yeah. There's not many that don't. Thankfully, yes.
And they get interviews, yeah. We do have a database that no one else does. But as best as we can, identifying which schools have background.
Nice.
So we just called all the schools. A couple of years.
Great. Oh, absolutely.
Okay, well, okay.
Yeah.
So, very high level.
Yep. Great discussion. And we heard our live stream, but we got it. I saw it. There's other sound.
Are you doing it? Yeah, so yeah.
I guess I don't know. For Facebook, because you can look at some stuff on Facebook. Maybe. Okay. I'll be sure to know. Yes.
But yeah, they just-
Yes, but yeah. Oh, yeah. Okay. Okay. Sounds good. Do you mind if I give it to? Well, I'm gonna look at it and then I'm gonna give it to Mary. Yes. And Mary's looked at it. Okay. Yeah. Oh, guess what? But thank you. Yeah. Yep. Yep. Okay. Yeah. Yeah.
Let me cycle through for questions. So it is, how many questions do you notice? Do I have anyone there?
Try to keep up with
Any others?
Yeah.
Oh, yes, should I give her papers to report?
Yeah.
I'm wondering if, like, are you getting any questions?
Do you mind if I use this as an introductory question?
If it's a fantastic question, I'm wondering if you could tell me.
Yeah.
Thank you.
Yeah, absolutely. And thank you for telling me.
All right, let's start.
from them.
Oh, no, but just last year. Yeah.
We were like 2 million.
If we have, can you tell me
Say like
there?
2 million.
We have already there. And this is
10%. We know.
Yeah, we did that. I'd like to see.
Is this one all? Is this one all?
Yeah.
Yes, and so, where is the mic? On the laptop? Or do you have
But we
a-
are really up to so that it really bugged me.
Do you think you want to say anything that? Oh, okay.
Yeah. That's like really.
Probably not for that. But, you know, I do think that it's surface level how many And with 9-year-olds, it's understanding the stress that guardian parents and then they take on that. They create there's so many more that is also being so and I think that
The bottom's messed up the whole time.
yeah.
Yeah.
So I think the effects from that. We just, I don't know. There's so many other pieces
Questions are coming in.
Get to that. I find that interesting. At some point, for show, it's like at some point, there's so much to share. Especially when it comes to
Okay, do you want to do a 2-minute warnings? Because you're going to get lots of 3 minutes or 5 minutes. Or here's at the end. Do you want them up here or do you want me to run them? I'll run them.
Sure. Or you can run them to whoever.
Yeah, I'll run them. I think most groups are done with their questions.
I'm okay. Hi, everyone. Just 5-minute warning. 5 minutes.
Oh, like, so I have 2 pieces of data that we got, and I'm trying to figure out the legal way to share it. And that's the first but I have to go. It's the same legal
Good, thank you.
Code of America. She talks about on the issue of census. No idea what
It is frustrating. It's easier to just type your hands. And then we're well, kids are falling to share. Continue to ask for those because we know it's like we're talking about. I don't think so obvious.
Stereotypes and assumptions being made. We're not just these further stuff because you know, you can take me on the bus.
Yes, I would go to get them. That's creating so many. That's destructive. So it's just so obvious.
I think we can, I'll do one last round. You say last call for
Last call.
last call for questions. Last call for questions.
Oh, yeah. Oh, interesting. Okay. Yeah.
Oh, one more. Okay. There we go. Thank you. Okay.
Okay, let me give you just a couple minutes to read these.
Okay.
Actually, until I start. Okay. All right. I'm going to bring us back together. We've got about 25, 30 more minutes. We're going to thank you. First of all, thank you all for all of the great questions so far. I don't think we'll be able to get through all of them, which I think is a good thing to some extent that we have so many questions from the audience here. So again, thank you. I'm going to start out. So we talked a lot in sort of the first half about school age children and the programs there. I want to expand it out based on a lot of these questions to some of the other age groups. So, there were questions about what types of programs are available from birth to age 5. What about college age students? And then there's also a great note about older individuals that, over a third of older individuals who live in poverty aren't using SNAP. So what is available for them? What could we be doing better in any of those sort of 3 age groups? So we're going to expand the conversation here a little bit out. So Rob, would you like to start us off?
Sure. Yes, that's a big question. We do some early education programs as well, especially through school districts. And I mean, there's significant need in all 0 to 100 years old, right? And what would you like to know about these age groups?
So do you do any work with any of those other age groups, your organization? How, and if not, is that something that you see yourself being able to expand to? Is that something in the plans, maybe for future? You also mentioned that there are a number of schools already on your list. So, if it's not within the scope of your organizations, are there any that you partner with that?
Got it. Okay. So we focus on PK through 8th grade as the younger kids are the most vulnerable as far as access to food. And early ed and infants, and that's a super important time as well. That's not where the infant kind of part is not where we work. That's sort of this different dietary stuff. There's a whole bunch of differences locating where those families are. We used to do high school and college age as well, so we had some college programs. Due to funding, we focused in on the PK through 8th grade. So as far as the capability and the impact of our program, there is models that would be successful in a high school and college setting, but we've had to funding. It's all about money. Funding we've had to decrease back or focus back on PK through 8th grade. At the same time, when we were talking some on the break about the impact that kids in food insecurity it's not just the kids, it's their whole family in food insecurity, correct? And lots of times the parents are the ones giving the kids as much of the food as possible, and they're going hungry, or they're cutting their diet as low as possible, which might affect their work, right? And which then is going to affect their income, and it's just sort of this big cycle. And as well, there's grandparents that are guardians of kids as well, and they're having similar issues. And so by providing, for us, we're giving these bags of food that aren't necessarily meant to be consumed only by the child. It's meant to go home and support the family in the way that the parent or guardian chooses to use it. To make sure, if we give a bag of dried rice in one of the or a packet of dried rice in one of the bags, and then make the rice, it's not like, well, the 8-year-old is only able to eat that rice, right? And so it might be they have a family meal, and then the money's available for other to be able to buy food and access food for other meals for the kids. But yeah, senior, there's every age group, there's lots of different issues, there's lots of different barriers. When we're talking about food gaps, those gaps are often created by barriers to food, right? So it's transportation, it's money, it's access to, there's food deserts, there's food swamps, which is, you have access to food, it's just really bad food. And so there's lots of opportunity for different organizations, like Meals on Wheels often is serving, which I think you say you give vet food? Yeah, so he'll talk in a second. But there's Meals on Wheels and stuff that focus on seniors, and we do the best that we can in our bucket.
So at Harvest Pack, the majority of our food does go to the local food shelves. So they're taking care of organizations that are within the community. A lot of the programs that we also focus on are backpack programs. So again, it's going directly into elementary schools. In addition to those two programs, we do provide food to Meals on Wheels, and those go specifically to homebound seniors. And they have very structured meals typically. So when they receive the Harvest Pack meals, either the rice pilaf or the instant oatmeal or both, those are like a supplement to it, and it's something that they can easily cook on their own. This oatmeal, for example, is just an instant oatmeal. So it's, again, designed so that anyone at any age can just add water or milk to it and put it in the microwave, and it's ready in 90 seconds. But with the Meals on Wheels, what we've heard is that they're living on Social Security, and those funds just don't last. There's not enough funding there. And with talk of Social Security being cut in the future, it's kind of terrifying to think about how many people are going to not only not have enough as it is, but then have a reduction. It's scary because we were just talking earlier during the break that as a parent, I know the lengths that I would go to if I didn't have enough food for my kids. And if I was truly desperate, how far would I go to take care of my kids? And so the expectation that they should just be abiding by societal guidelines to get by, and when there's not enough, could be really frustrating. In addition to the Meals on Wheels, we also went to the University of Minnesota. There's a food shelf that's run by the students, and we interviewed some of the students there. And things that we heard were fruits and vegetables are expensive, so they get skipped. And they're the nutritious part, right? They're the part that really can make a difference on us receiving enough vitamins and minerals in our daily lives. We heard from them that they do have grants and scholarships, but they cover tuition, right? They cover rent. They're not there to provide food. So again, there are some students that are falling into the cracks and don't have enough. So luckily there are food shops that are covering that difference. So we provide food to them, and they can have as much as they want. Each of these bags, like this bag, for example, has 8 meals in it. So it's more than enough to get you through the week. And it's there for college students. We have it for the Meals on Wheels as well. And we're hoping that makes a difference.
All right, I have a few pieces to add here. So first with the aging population. So I actually got my start. The first job I took out of college, I was an aging and disability services specialist. And some of the programs that I helped to coordinate there was the home delivered meal program and congregate dining. And so there are, drawing it back to what I do now, USDA does have funding for the congregate dining program for older adults. This isn't an everything program, and many times communities are not able to do a congregate dining program every single day. Where I was working, again, in a very rural community, small town community, I worked for the county, and our county had a couple of sites that had, maybe 2 or 3 times a week for these meals. Otherwise, it would be once or twice a month. So again, it's not an everything, but an opportunity for older adults to come in, have a healthy meal. But many times too, we would attempt to bring in some type of education for that meal as well. How do you access SNAP? How do you access other food? What maybe we brought in food shelves during those opportunities as well. And so there are still those congregate dining programs going on, and again, funded by USDA. The home delivered meal program, I think, is in part funded. I'm kind of out of that now. I'm not quite sure. Obviously, home delivered meals is such a vital program. because it is for those homebound adults that are not able to get out and do that congregate dining. It also is so much of a relief to family who are not able to check in on mom or dad every single day, but you know that someone is there and they're going to check on them. And our home delivered meal drivers became such good friends with our clients who use that program, right? Because it's not just dropping off the meal. A lot of times too, it's, oh sure, I can absolutely change that light bulb real quick for you. And you don't know how many times you have a senior that is going to be sitting in the dark because of, pulling up a chair or something of that nature. So having someone coming in and just being able to take that extra 2 to 3 minutes to help with something, sure, I can plug that back in. It came unplugged, right? So home delivered meals is really important. Again, I'm out of that now, but worked with that in the past. And then to the opposite age range of that birth to 5, our USDA programs where I do work now, we have the Child and Adult Care Food Program. Just a side note, you might have heard adult, that's adult day centers. It's very limited. We don't have many in the state that are operating that program. But again, adult daycare type centers for adults that have met certain health needs, we can provide some meals for as well. But in that same huge oversight of program of CACFP, that is where we are targeting, is that birth to 5. And so childcare centers, family daycare homes, before that child is school age, to begin to build their foundation with nutritious meals. The issues and the gaps there is that not all childcare centers and family daycare homes are going to be eligible, and the funding is extremely low for a very high administrative burden. And so this is where our sponsoring organizations come in so helpful to play to take on some of that administrative burden. The issue and the gap here is that we don't have many sponsors, not just in Minnesota, but in the nation either. I will say a caveat to that is Minnesota is home to the largest family daycare home sponsor in the nation. And so they oversee right now, I believe it's 3,000, 3,500 family daycare homes just in Minnesota. Again, largest sponsor. The last thing I'll say too, and it kind of goes back to, I'm looking at my notes, my first piece that I mentioned with technology gaps and older adults being able to access SNAP, the technology part of it and the enrollment forms, the administrative burden and barrier that is applied to many of these benefits is very high, and expecting someone who has maybe not used those technologies their entire life and then forced to use those technologies to know where to go for the enrollment forms, to know where to get it submitted to. And for any of those who's been on SNAP or benefits, you get mailed letters. And if you don't get that letter turned around in, like a month, you're done. Your benefits end. And so then having to monitor the mail as well with those benefits is an even more administrative burden.
Emily, can I add? There we go. I'm going to ask you a little bit more about the adult daycare centers. Yeah. Is there a reason that there are so few? Is it just not well advertised? Do they not qualify? Do we not have enough money to support the number that we need?
Oh, good question. So the money piece at this time is not a problem in terms of accessing funding. So the funding comes from the federal government. The state of Minnesota does not provide funding for the adult daycare home section of this program. It's completely federally funded, and they're entitlement programs. So what we use, the government has to reimburse us for. So that piece of the funding is not an issue. The reimbursement rates, again, are fairly low. It's barely enough to cover the cost of a meal. And so these adult daycare homes or centers do need to provide that additional funding or have that food piece already set in place to provide that backup. Additionally, I don't think there's so much as a lack of centers, but again, there's that eligibility component. And so the USDA programs are meant primarily for low income areas, students, individuals. And so that adult daycare center is also going to have to prove that income eligibility. Typically that's done with Medicaid enrollment for those at that center. So again, just additional administrative burden, the ability to provide additional revenue for those meals, and on top of it all, having to be at a certain menu pattern meal quality. That alone is an administrative burden as well. We talked about obtaining the right food and getting variety in there. So sometimes those centers, whether it's adult daycare or childcare or so on, they just say, this is too much. I need to focus, like I already have to put up money. I need to just focus on making this the most cost effective. And it's taking one person just to do the administrative part of this. And so then they might opt out.
Great, thank you. Oh, sorry, I'll make sure that I give it an extra couple of seconds for it to come back on. I'm jumping the gun here a little. William, I wanted to sort of piggyback off of a comment that you had made around fruits and vegetables and how college-age students are often skipping those. That's a question that came up. A couple of questions actually came up from the audience here around either partnering with farmers, established or emerging farmers. Is that something that your organization does, or that you know of food shelves that you work with that partner with local farmers? Is that an opportunity in the future potentially?
Yeah.
Oh yeah, sorry, turn the mute there. There you go.
There we go.
Yeah, thanks. So one program that we have with schools, where we partner with them to package up the meals, is it's a seed program. And if the school is interested in doing it, then after we do our education piece and talk about where the food has come from and how we couldn't be packing these meals without the students' participation, and then who will be receiving the meals and how it will benefit the recipients. We have a seed program where we'll hand out seeds, and we'll talk about what we'd like to see them do with the seeds and how easy it is to grow them. So these students can then bring the seeds home, their tomato seeds, that they can put in a little pot in the apartment windowsill or in the yard to grow. And from there, we have a lot of information to share with them too, so that they learn how to grow them. And then our hope for them is that they'll take half the tomatoes they grow and bring them to a food shelf to share. The other half, we hope that they'll cut them up, share them with their family, and harvest the seeds. So not just pop it in their mouth, but the seed's actually a little bit bitter. And so when you take them out of the tomato tastes even better. So, yeah, so when you take the seeds out and harvest them, you can then share them with your friends and neighbors, continue to regrow them. And that's how we are sharing the harvest and having the opportunity to learn about how easy it is to grow and grow nutritious food too. So it's an opportunity to provide something that's sustainable. So that's kind of how we tackle that.
Nice. And Emily or Rob, is there anything that you'd like to add, working with local farmers, either to disperse food through your organizations or partnering with them and helping to connect them to people in need?
I'm really excited about this. We've done this before, but with Minnesota Free School Meals, we're putting so much emphasis on this. And that's our Farm to School program, Farm to Early Care. Food is great. Meals are great. We know that local fresh foods are going to be more nutritious. And so there's absolutely a need and opportunity to bring those into our programs. Also, when we have additional local farm to school programs, farm to early care, that is drawing support from your farmers and from your rural communities that may not have connected the support dots before. And so we're really laying into that, and farmers are seeing, oh my gosh, maybe I didn't support Minnesota Free, and I'm not saying all farmers, I'm saying like maybe there's that one farmer who said I wasn't necessarily in support of Minnesota Free School Meals, maybe they didn't have a child attending school, and now they're seeing that school have additional revenue coming in, focusing on bringing in local foods, fresh foods, and they're saying, hey, my farm is now expanding, I'm making some more money off of this, we're getting local foods, nutritious foods into schools and early care as well. So we're really heavily focusing on this. We have a farm to school coordinator, farm to early coordinator. Actually, I think we have a student intern position open right now. I don't know when it closes, sometime soon, for farm to early care. So if you're interested in that. And then the other piece too is what William was talking about with the growing and making it that teaching moment, making it that educational opportunity. And there is a lot of educational opportunity in there, because not just serving the food that is fresh and nutritious, but then showing that child, showing that participant, how does that food get there? Where does it come from? How to grow your own food, and really teaching those life skills as well.
I don't have a farm related thing, but if I can go back a little bit to access for food support other than kids. Couple things. One, with the SNAP enrollment, I think you have to do an in-person interview still.
Ooh, I'm not sure on that.
At some point, you had to like go and do an in-person interview at some, if you're in Hennepin County, it was downtown, you had to park, like it's not easy. Go look up the SNAP form and see how easy it would be for you to fill out the information that's on it, because it's, well, around tax time you might be able to, but other than you wouldn't. And then additionally, we talk a lot about like food shelves and food shelf supporting local communities, but there's not necessarily easy food shelf access for a lot of communities. So say you live in Roseville, right over here, which is where our office is headquartered, and I get phone calls all the time because we're not a food shelf saying, hey, we need food support, what's the closest food shelf? There was one in New Brighton, St. Anthony, closed in October. The closest one is Mounds View or Columbia Heights or Oakdale. Those are the closest food shelves to Roseville, which is a pretty big city, right? We're not talking, it's a big city. But there isn't easy access to a food shelf. So I got a call, what day is the day, Friday? I got a call yesterday on our office phone. I need a food shelf. I look up, I just learned Nourish 282, which is the food shelf, just closed, the one here in New Brighton, St. Anthony. I tell him these other ones on the phone. He's like, oh, which one's on a bus route from Roseville? I was like, I don't know. Like, can you take a bus from Roseville to Oakdale? I don't even know. Or to Mounds View, you might have to like go into downtown and come back out. So there's lots of limitations to access. And we a lot think like, well, the food shelf, it's close by. It's like, it's not necessarily. And it takes a car to get there. I mean, I don't know how far Mounds View is from Roseville. It's a metaphorical dirt road that you have to walk down in a small town. So there's just lots of barriers, and we're all obviously trying to do as much as we can, but there's still lots of barriers that people are facing.
Yeah, there's actually a comment here about how food shelves have been around for decades. And really they weren't necessarily meant to be permanent for people, right? Maybe the idea is that it supports you for a while until you don't need them anymore, or hopefully someday we won't need them. What do you think sort of upstream are the factors that we should be targeting? Is it transportation? Is it job support? What do you think upstream factors would be that are really at the root of some of these problems?
Well, I would say the biggest upstream factor is education. And actually a lot of our programs are supporting kids in their education. That's sort of the point of what we do is wanting the kids to be able to have removing one of those barriers to access to education. So if you think of, I'm sure everyone here knows Maslow's hierarchy of needs, right? And so you all learned that in your classes. And so if the bottom base, food, housing, water, that kind of stuff, if that's not secure, when you're talking about the things to build on that's not going to work very well. It's not, you're not going to pay attention to those necessarily, depending on your situation. But so that's part of why we're doing, well, certainly MDE is education. But that's the impact of our food having on the kids, so that currently they can pay attention better in school, so they can have a shot at a better education, so that they can have a better shot at breaking the cycle of poverty in 10 to 15 years or whatever when they're adults. I would also, outside of my realm of expertise, I think one of the biggest single things that would have one of the biggest impacts on poverty in America is childcare. The cost of childcare and the impact that has on families, and individuals in their immediate earnings and long-term earnings that, especially moms, end up taking on, or grandmas end up taking on and leaving their jobs and trying to cover those gaps. And so that's just, I do not have an answer for that, because childcare workers should be paid more and it should cost less. So if someone can fix that, good luck. So I think that requires government intervention. But I mean, housing, education, food, childcare, special education, diet. I mean, there's a lot of job training. Should we get a whiteboard out?
So I think it's education, and I think it's cost, right? Those are the two big hurdles that we have to face. And with the government saying they want to reduce government and reduce spending, these things don't add up. Like we can't put less money into it and expect people to have more, even if they're the necessities. So it is a struggle, and that's why we're here having this discussion. I think that education is a great piece to that as well, because the more people have an understanding of all the problems and can logically see it through to an end, can give us a better chance at succeeding. It could just mean more gardens in people's yards, or more open space being converted into gardens that people can share. It doesn't have to be more money necessarily. If there's more understanding of different ways to justify or prove success, then I think we will all be better off. That might be a bigger problem with having too much capitalism, right? If we're not making money at it, then we're not going to do it. And that, I think, then in lies additional problems. So if we can continue with education and find different ways to produce food that we can share with one another, then we should be able to strengthen our communities.
Yeah, this is a tough question. I think all of us, right, if we had the answer, we'd be trying to do something more with that answer. It changes so much when you're looking at whether it's a certain program or a certain issue. So I don't really have the answer. I would agree with education, and I would also say that I'm in the place that I'm in, and I'm in the programs that I'm in because I feel so strongly about creating good foundations for children. And when you create that good foundation, provide them the education, whether it's the ability to have a good learning environment by having that meal in their belly, and then they can learn the math and the science and all the things, but also education of food education. I think that foundation is what sets children off to be successful adults, well-educated, understanding their needs, understanding where to get their needs fulfilled. Yeah, so I'm kind of stuck on that one. I think there's a lot of pieces at play. Along with it, I would say, the educational component, not just for kids, but educating your community, educating your groups with what you hear from these types of forums. Hey, did you know about this? No, this is where you can find things. Hey, I know a nonprofit community or organization in my community that's doing something with meals. Have they ever thought about getting onto the program? Maybe these are areas where we can then provide some additional funding. So that sharing of knowledge, that education, I don't think ever stops. And I think that's probably where I'll leave my answer with today.
Oh, yeah.
Just want to add one thing, and I really need to find this source because I don't remember the exact stat, but most people in America at some point need support outside of their familial structure, government, faith community, something, at some point in their life. And so, like food support or that kind of support. And so when we talk about, like on our program, we have people that might be on it for 3 weeks because there was the car broke down or whatever, like there was an immediate acute need. Some people might have kids that are, they're paying for childcare or they're not working, and so there's that need for 5 years, maybe, or however long. Most people are not receiving food at a food shelf for their life. It's typically a period of time, or our programs or whatever, period of time to get them through some situation to where they can become more stable. Not everybody, but most people. And most people have that need at some point. Not necessarily going to a food shelf, but some sort of significant support outside of like their nuclear family. And so some of us are able to seek that, say, from our parents who might have some means or something like that. Lots of people don't have that support. And so that's just one, I like to remember that it's not like my mom has received food support when my dad died when we were in high school, right? And that was just for a period of time to get through a few months of something happened all of a sudden. So the idea of food shelves, they weren't, I don't know if they were meant to be long-term or not, but people receiving food from food shelves is typically they're not doing it like for a decade or something necessarily, but it's to get us back on our feet, moving forward in a more self-sustaining way. And there's a very good chance that people in this room have needed to use that or will need to use that, and that's okay. And that's part of a community, and that's how we support each other in specific times of need to move forward, in my opinion.
Yes. Yes, I know that was a loaded question to end us with, definitely. And the answer, of course, right, is going to depend on what age group you're looking at. And so, what the needs are for birth to 5 or, school age kids or college students or older adults is going to be dependent on that age group, and what exactly you need to do to address those is also going to be very dependent on those age groups as well. So it's definitely a very, very complex issue, but thank you to our panelists for being here today, first of all. And then also thank you for all that you're doing too. It was great for you to share about the organizations, what you're doing. We'd love to continue to stay in touch and learn how we can continue to support too. Oh yeah, go ahead. Thank you. Got it. Yeah, no, that would be great to continue this conversation and to expand it too. Keep the conversation going. So as I had mentioned at the beginning, this is the first of 3 policy forums this year. We have 2 more coming up. The dates are on the back of that agenda. So our next one is going to be March 21st. And that one will focus on mental health. So as I close us up here, first of all, I want to thank the Policy Forum Committee for putting this together and putting together the whole program for this year. And then also our friends of the forum, whose names you can see on the back the agenda as well. It really is because of you all who are here, but also people who continue to support us in other ways that we're able to keep doing this. So I'd also be, 2 more things I think, right, Lindsay? I'd be remiss to say if you aren't a member of MPHA, please consider joining. We love having a very diverse group of voices that are coming together to have these types of discussions and really building that community to go out and be able to do things. The next thing that we want to celebrate is having so many people here together in person. So we actually have a little gift card giveaway. So I'm going to do 2 questions. The first one, has anybody had a birthday recently? Whose birthday is the closest to today? Mine was January 9th, but I don't think that I'm eligible to win. So anybody else had a birthday recently in the month of January coming up?
No other Januaries?
All right, what about December or February? I see some hands. Anybody want to share just the date, not the year?
That's okay. The year would be fine.
That's true. That's true. I know some people don't want to share that.
December 30th.
December 30th.
Ooh.
Is there early February?
February 28th.
Oh, that's math.
Yeah, I was like, Lindsay, we did not plan to do math in front of people today.
When's yours?
Oh yeah, was there another one?
Oh,
What?
No, I'm early December. She beat me.
okay, late December and late February. All right, should we do those 2?
Yeah, let's do those 2. Perfect. Happy early birthday, happy late birthday. Again, thank you all for being here. And yes, there was 3 things. Oh. I got past a note before before. So Second Harvest Heartland is having a Make Hunger History Summit that's coming up January 31st. So it's going to be hosted at the Heritage Center. Please feel free to come up here. I can show you this. Maybe we can also post it on MPHA's website. So you can always go there and find it too if it's something you're interested in learning more about, and other places to have these conversations. Oh, and there's a table in the back too. See, I haven't been here in a while in person. So there's a table in the back. I think there are some fun giveaways, some little calendars back there from APHA and some other things. So I know we're a little over time, sorry. But again, thank you everyone for being here. We look forward to seeing you at the next policy forum.
Thank you. Thank you all so much.
Oh, you never do.
Yeah.
Okay, everyone remember there's a pledge back.
Yes. Oh, yeah.
Yes, thank you for having me.
Yeah, and there's like a staff person.
That is making me super nervous now.
Oh,
Yeah.
Yeah, and there's.
Yeah, but lots of, did you see how many?
all right.
You should make